I'm your typical physician. I was trained, I know my drugs, I know my diseases, and for 21 or 22 years of my medical practice, I did everything I could to get patients off supplements because I was taught all you needed to do is eat a healthy diet, and you can get everything from your food. That all vitamins did was create expensive urine, and that was what I was taught, and that's what I told my patients. And obviously, my wife was the reason I got into nutritional medicine because she suffers from a disease called chronic fatigue fibromyalgia, and she suffered. And in 1995, she went through about 4 or 5 months where she couldn't get out of bed for more than an hour a day, in spite of seeing 4 different medical specialists who put her on 9 prescription medications. And when she started taking supplements, which she knew I wasn't in favor of, but I said, you can try anything. She had an amazing health improvement. And so I had to just do my own research because I'd been telling my patients she didn't need these, that there was no benefit. And that's what I've done for the last 24 years. I've been studying the medical literature to show what health benefits my patients can receive by taking high quality nutritional supplements. PureNourish is a meal and a snack replacement. That's just simply put that way. And I use it in my medical practice, and I'm going to fake some people out here. I use it as a behavioral modification tool. People get into trouble because of the all-American, all-Canadian diet and just inactivity, and they become less sensitive to their own insulin. And 80 to 90% of the carbohydrates that people consume today, both in the US and Canada, studies show are high glycemic. In other words, they spike your blood sugar very rapidly. Well, over time, this leads to an abnormal metabolic state. We refer to it as prediabetes or insulin resistance. I call it the metabolic syndrome. But you are set up to gain weight, and central weight gain is part of this whole picture. Well, as a physician, I'm concerned about weight, but I'm also concerned about the other things that come around weight gain: high blood pressure, elevated cholesterol, triglycerides, low good HDL. You start to gain this central weight. You see your blood sugar start to go up. You're at high risk both for heart disease and diabetes. So those are things that we as physicians get concerned with. And in fact, that's why a lot of physicians refer to this central weight gain as killer fat, because it's associated with all these other problems. So the hardest thing we have to do in medicine is to get our patients to change their behavior, to make these good behavioral modification changes, healthy lifestyles, and firmly establish them. So PureNourish is something that Deanna and I developed when we first got to RX. And we wanted a simple, easy way for our patients to experience a low glycemic meal or snack. Well, we wanted it to be healthy and balanced. So we put in good carbohydrates that do not spike your blood sugar, good fats, and good proteins. And it is a well-balanced, it's like a healthy diet. So in my medical practice, when I get people on the Slenderized program, I want them on PureNourish. Many will take it even for 2 meals a day, once or twice a day. But and we wanted it to be non-GMO, gluten-free, soy-free, dairy-free, and we wanted it to contain probiotics, digestive enzymes, so that it would really allow my patients to experience this low glycemic lifestyle that I write about and teach all about. And it's wonderful. I've used it in similar products in clinical trials. I've done 3 clinical trials with my patients where we use a healthy diet that does not spike your blood sugar, modest exercise, and nutritional supplementation. And what people need to know is when you spike your blood sugar, you can set off an uncontrollable hunger for 2 to 3 days. So I call that a carbohydrate cravings or addiction. And to get people out of that, you got to be really aggressive. And it takes sometimes, 5 to 10 days to get people out of that. But when you do, your natural appetite comes down. And so people begin to actually eat less. If you're adding Slenderize and Accelerate to it, it makes it easier. You even become, that controls your appetite even more. So PureNourish is a wonderful, easy way to have a low glycemic meal where you don't spike your blood sugar, you avoid all of that, and over time, those carbohydrate cravings and go away, and you start improving the underlying problem, and which is insulin. You're resistant to your insulin, you're getting more sensitive to your own insulin. And then all of this changes. Your blood pressure goes down, you start to see cholesterol, triglycerides go down, your blood sugar goes down, and then, oops, all of a sudden you begin releasing fat. So my patients in the Slenderize program, they'd say, well, Dr. Strand, what's so hard about never going hungry, feeling great, having actually more energy, more focus, seeing your health parameters improve, and you begin losing weight, and I'm not even trying. Why aren't they trying, Allison? The reason they're not trying is because we're not relying on willpower. See, the greatest drug we put in our mouth are the foods we choose to eat. And so when you look at the entire Slenderize program, you want to be eating these foods because they have been selected as healthy foods, whole foods, fruits and vegetables, the good healthy fats and protein. That's excellent. And so that's part of it, but we want to keep moving. So simply walking 25, 30 minutes, 5 days a week, not every day. Give yourself a break. And then one of the questions I'm going to answer, they say, well, what nutritional supplements do I recommend with the program? Well, at least on a minimum, I want the optimals. Now, if some people want to take MOA, that's okay. I prefer the optimals because of the minerals, the optimal V and optimal M. That is what I use in my medical practice. I did in the clinical trials, and we saw a wonderful response. And what the other things you can add, obviously, is MOA. People like to do omega Q, but the other thing that people, when you start to lose weight and you start to really detoxify, and a lot of your pollutants and heavy metals are in your fat, so people will go to Restorex. How much protein do we normally need? It really is based on your weight and size. If you're a big person, you need more. So I like to use percentages. I like 20 to 25% of our calories to come from protein. I like about 30% to come from good fat, and 40 to 50% to come from good carbohydrates. So that will vary, but that's kind of how PureNourish is put together. Now, some people, when they're losing weight and all of this, are at least complaining. One of the questions was about cramping, leg cramps, and would optimal M be good? Well, I've already told you I like the optimals, but if you get leg cramps, the problem is a magnesium deficiency. And so what you really need to consider is adding Magna-Cal D. And that is, if that doesn't settle it down within a week, I actually would go out and buy a separate magnesium citrate. There are companies, it's hard, but I do that because it's a magnesium deficiency. And that's the thing that really helps that, because we had this fear of fat for 40, 50 years. But now what we realize, and even the American Heart Association, all these people realize, there's good fat and there's bad fat. That's something you have to realize. So there's good carbs and there's bad carbs. And so we teach this. And when I come up to Vernon, I'll be able to share. We're going to have a great time on Saturday sharing, the whole concept of what we call first step therapy. That's Nutrify. That's a subtitle, first step therapy. And what it basically means is we as physicians, we want to give our patients a trial of healthy lifestyles as the first step to therapy in a lot of situations like early high blood pressure, diabetes, or high cholesterol, all of these things. And that's, we'll share, because that's what Slenderize really is. The Slenderize program is first step therapy. And you're not only going to be able to lose weight effectively, because if you don't improve the insulin sensitivity underlying cause, you just don't have success, or you gain the weight back quickly, we're correcting the underlying problem.